Hi, my name is Kit Yunam. Thank you, GSPA, for giving Kaylee and me this opportunity to present our project. Identification of lipid species, potential biomarkers for early detection of hepatocellular carcinoma. Part of this project is under the Graduate College Rebel Research and Mentorship Program. Dr. Guan is the project's advisor. In this presentation, Kaylee will give an introduction on the HCC and also our project, and I will talk about the methods.
Beginning with an introduction to hepatocellular carcinoma, HCC is in fact the most common type of liver cancer, claiming over 600,000 lives each year. And most patients with HCC present with a history of cirrhosis, most often attributable to causes including a previous hepatitis viral infection, chronic alcohol abuse, and non-alcoholic fatty liver disease, or NAFLD. Yet in any case, research has shown a poor survival rate for HCC patients due to the diagnosis of HCC at later, more advanced stages compared to patients diagnosed during early stages of the disease. With limited curative treatments available for late-stage HCC, this truly emphasizes the importance of employing preventative measures for the early detection of HCC. This brings us to our current approaches for detecting HCC, which involves routine screening of high-risk patients through either ultrasonography, computed tomography, or magnetic resonance imaging scans, along with general biomarker assessments, most commonly quantifying the serum levels of the biomarker alpha-fetoprotein. However, these strategies are suboptimal. As seen on the very left-hand side of the slide, these techniques expose patients to unnecessary morbidity and risks at an expense, often insufficient for the diagnostic performance during early-stage HCC. For instance, HCC is on the more severe end of NAFLD, or non-alcoholic fatty liver disease. Early-stage HCC can be differentiated from other diseases on the NAFLD spectrum through histological results of a liver biopsy. However, obtaining this biopsy involves an invasive procedure, leading to patient discomfort and potentially to severe complications such as neoplasm, infection, wound breakdown, and hemorrhaging. But a better diagnostic test involves these three phases: lipid metabolism, animal models, and humans. Given that NAFLD is associated with lipid metabolism disorder, by understanding the pathogenesis of NAFLD associated with HCC will improve the specificity and the sensitivity of HCC screening, which will ultimately allow for the early detection of HCC. In this study, we used the NAFLD-STAM Model, which mimics the progression of HCC carcinogenesis in a relatively short period with 100% reproducibility. And lastly, the use of the animal model makes the human disease experimental testing and multiple sampling feasible, which enhances the lipidomic study of cancer. And as shown on the slide, the purpose of our research is to identify potential lipid species biomarkers for the advancement of the early detection of HCC, where alterations in lipid metabolism during carcinogenesis from pre-tumor tissue towards HCC were investigated. Moreover, by developing a convenient, clinically translatable, multiplexing lipid species biomarker test using patients' plasma, this project aims to avoid the unnecessary exposure of patients to the risks of the current methods for detecting HCC. And overall, with the crucial role of lipid metabolism in the development of HCC, along with the assistance of biomarkers in the identification of HCC, this project intends to ultimately change the paradigm for the early detection of HCC.
In this study, lipid composition in samples were profiled by an automated electrospray ionization tandem mass spectrometry (ESIMS) at Kansas Lipiomic Research Center. Filtering methods was used to obtain a small list of lipid species for statistical analysis. To identify the potential biomarkers, lipid molecular species with significant change were retained for further analysis based on the number of carbons and the number of double bonds in the lipid molecular species. This is how we do the filtering. Lipid species and lipid groups with detectable signal above the detection limit and the coefficient of variation less than 0.3 were included. Statistical analysis was used to compare the differences in lipid profiles across different disease stages. In our preliminary study, an NAFLD-STAM model, an animal model were used to investigate the species alteration in lipid metabolism. A total of 30 liver tissue samples were collected from normal mice, mice with chronic fibrosis, and mice with HCC tumor. 10 samples from each stage were included. Lipiomics analysis was performed by ESIMS to detect 1881 lipid species. Preliminary findings. Based on our preliminary findings, we conclude that different lipid classes and their individual molecular species reflect the progression of HCC. To understand the detailed mechanism of lipid alterations, we need additional study. So we want to do our study on human tissue samples. Currently, we are investigating the alterations in lipid profiles between the pre-tumor and the HCC liver tissue samples from human. Expected results from the lipid profiles and human liver tissue samples. We expect to see the alterations in metabolism. This can be indicated by the significant difference in lipid distribution and the composition between the pre-tumor samples and the HCC tumor samples. We also expect to see more significant change in lipid species from certain lipid classes. Here is the project timeline. We have spent 6 months on the data processing and data analysis, and we are preparing final results and the manuscript. And here are our references. That's all we have, and thank you for your attention. Again, appreciate to have this opportunity to share our work.